I don't know what to do with all of them sometimes. Okay. So I'm going to start sharing our screen. You will also receive, we'll make sure that you get this PowerPoint along with, I don't know that I mentioned that, but you will get this PowerPoint along with the other things that we're going to send you. So can you all see my prevention science screen? Thumbs up. Okay, thank you. So prevention science, let's talk about it. You know, a lot of people who may not be in the field hear that word prevention science, and you know, they think of science as, you know, those little test tubes that you saw, things like that. But prevention is a newer science as we're moving forward. Sometimes our work is really difficult to describe. So this is a really good tool up on the screen that we use to describe what exactly we are doing, what our part is, and then what else is needed. So we like to explain, we're not trying to be great at everything. We're taking a little piece of what was internally, we call it the orange slice because it was orange. This is a little bit of a new updated version, but what is needed for folks as far as the mental, emotional, and behavioral health interventions? Some people think of this as interventions with drug and alcohol. You know, it can be for those mental, emotional, behavioral. So it really runs the gamut of what is needed to make sure that we have both healthy youth and healthy adults thriving in our communities. So the first part here is promotion. So just talking very, very generally about health promotion, what that looks like. And again, health, it can mean so many different things. This, the spectrum really does take all of those. If you are interested, this is through the National Academy of Sciences, the Institute of Medicine, but we'll make sure you get this if you're curious about reading more. And we'll also send you other explanations. But when we talk about promotion, we're talking about our societal, talking about our community, how to make a healthy community, and how to make healthy individual and families. So this is a little bit right here where we start the promotion, and moving on to prevention is really our big piece that we're going to be talking about today. So prevention is preventing a problem before it happens. So what we're going to do to prevent problems before they happen is we're going to look at predictors. So there's a couple different categories that we focus on as far as prevention. So the big category here, one of the changes was this slice got a little bit wider because it's universal. So universal prevention is prevention that's good for anybody, not showing signs or symptoms or any of those risk factors. They're not showing anything. They're programs and initiatives that are good for everyone. There's not a wrong kid, quote unquote, wrong adult, wrong anything that can have this sort of preventative interventions we're going through. So an example that we use a lot are the strengthening family 10 to 14. You know, I'll leave that definitely to our implementation specialist. But that's a program that there's no wrong family. You don't have to be a broken family to be in that program. You don't have to be an adjudicated youth to go into the program. You don't have to be any sort of systems. It's something that everyone can benefit from. Another example are different things within health classes. If a health class is implementing the life skills training, again, good for everybody. So moving along to selective, this is the group of folks who are just starting to show those little signs of a problem behavior. So we make sure it's our job to kind of stop, see if we can do an intervention early, so it doesn't end up looking like that bigger behavior problems. So this is for the folks who are just showing a little bit of those signs right at the beginning. Indicated are those ones who are really, really close. I kind of think of it as towing the line between, they're not quite to that behavior problem yet, but they have a lot of risk factors that would lead them in that direction. And they are demonstrating some of those risk factors. So in this case, in the indicated and also selective, there are certain youth, certain adults who would be appropriate for some of those programs and for some of those interventions throughout. So that's kind of where our area of expertise is. For the most part, that's really where we're going to be talking today. But we also let people know, the next part of this is just as important. You hear about it a ton. This is talking about our treatment. So whether treatment is for, anything as far as mental health, drug and alcohol, any sort of behavioral issues, this is where, the behavior problem occurs. This is where it starts. So we're completely changing our approach. So a lot of times when I come in and I talk to folks about prevention, again, this is a really good tool to show them there are different specialty areas when you are, whatever you want to call it, preventing, treating, when you're looking at that mental, emotional, behavioral health spectrum. Of course, after treatment, case identification, if you are categorizing what sort of intervention they need. And then, of course, is maintenance. So, when anybody goes on drug and alcohol, they don't just push them out the door and say, like, okay, you're cured. There's a whole other section that needs to be taken into consideration when you're looking at the long-term health of folks and folks who have been case identified as needing treatment. So I encourage you to use this. There's a lot more information about it. It gives a really good visual for folks who aren't in our field, who don't necessarily understand, well, what does that prevention mean? Does that mean that, you're going and finding people who have substance use disorder and, helping them through it? I kind of say, if we do our job perfectly and correctly, there will only be half an orange slice. We won't have treatment and maintenance. I mean, that's, a perfect world. But, if we are doing our jobs, if we're preventing all these things, we won't need to move forward with this treatment and maintenance. And another big thing too, is when we're talking about prevention, it is a lot less tangible. We're not putting beds in treatment centers. We are really working on those skills to help youth become healthy adults within healthy communities. And we're going to talk about a couple data sources and how we're showing that progress, but that's not something that we can touch and feel. So it tends to be a little bit more difficult. I'll put out there, a lot more funding tends to go to treatment and maintenance. One of the reasons is because of that. It is the more tangible. But if we're looking on return on investment, if we're really looking to make a difference, we really need to go in and start before there's any indication of a problem to prevent it from happening. So when we talk prevention, that's what we're talking about. All right, I'm going to move us forward. So just a little history lesson on prevention. I did say it was a new science. Prevention this all comes from the Coalition for the Promotion of Behavioral Health. That is another link that you will get. It's a whole book that's Unleashing the Power of Prevention. This is a little bit of a history lesson, but things that were happening in the 70s, the 70s is really when we started using that word prevention and understanding that it is part of what we need to do. We can't just sit there and wait until things bubble up, become a huge issue. We need to do something before things happen. So, providing information, letting people know, this is out there. Here's what it does. Here's the substance. Here's what it does. Sometimes using that information to arouse fear. So we have a couple programs that were in implementation that were used to scare kids. Don't do this or this is going to happen. Don't do this or you're going to end up in jail. If you continue down this path of delinquency, I'm going to take you to jail and show you where you're going to end up. Ideally, that works for the adult brain. If you take me somewhere, if you take me in the back of a cop car and you take me to a jail, I'm going to be like, nope, I'm good. I don't want to go there. That's fine. But that doesn't work for the youth brain. The youth brain doesn't work that way, as we're finding out throughout the evolution of our prevention science. And we'll talk a little bit more about that. The just say no just say no. Kind of period, end of story, using that tactic of, teaching kids to just say no. It's like, that's great, but you need a lot more context around it to move forward. So really what has happened there, as these things get tested, we kind of rode along a little bit and saying, yeah, us adults think these things are a great idea. They're done with great intentions. No one is out there looking to not make a difference. So what was happening was there was no decreases in the drug use or delinquency after some of these programs and initiatives were implemented. Some of the information programs actually increased drug use, which is even scarier. The kid brains are finding out, what these different substances are, and they're like, "Hey, that sounds okay. I think I'm gonna go use them." And in some cases, those scared straight programs have actually increased delinquency. So after we took the time to really evaluate our programs, I'm going to say that's why we're so evaluation heavy here at EPIS and with any prevention programs that you are running. We just rode along thinking that these are good ideas. They sound like good ideas. But what we're finding out is untested good ideas can actually make things worse. So the complete opposite effect of what we're really trying to do. So before we're investing our time, our money, resources, whatever else, we want to make sure that a program is going to work according to the data that we're looking at. And it's the same thing for your communities. So again, Unleashing the Power of Prevention. This is a document that has taken a lot of scientific research, and instead of just giving you the research articles, they have given you kind of a smaller booklet explaining, the history of prevention. What can we do about this? What has proven to be effective? This is available online. It is a great, great, great resource. Since this is a newer thing, a newer science, there aren't a ton of resources out there right now in regards to prevention and what exactly it looks like. So this link for Unleashing the Power of Prevention will be on your resource list that you will get at the end of this training. And it's free. Anybody can view it. It's not behind any sort of paywall or, library or anything like that. So talking about those untested theories and talking about what evidence-based is, we throw around evidence-based a lot. Well, what exactly does that mean? And it means that we know it works, but there are different levels when we're talking about how things work. So if we're looking at this visual, again, this is a really, really great visual. When you're explaining to stakeholders, when you're explaining to your community, well, what does evidence-based really mean? And how do you know? Again, great visual. So I'm going to talk about this in terms of communities. So if we're talking about coalitions, we're talking about maybe some practices that they've done. We're talking about official programs, some initiatives. So under these categories, if we go all the way to the right, all the way in our effective lane, we are very confident this program is effective. How are we confident? It's been evaluated and shown to work. Not only has it been evaluated in one place with one community with one type of population, it has been replicated in many different places and has shown high effects. So a lot of times these evidence-based programs are going to be on list. So the list that we primarily use, and again, this is going to be on your resource guide, is the Blueprints for Healthy Youth Development. Those are showing you the most rigorously studied and evaluated programs so that you can get the biggest effect for each of these programs. So there are other lists out there. I encourage you to do your own kind of digging. Some of the lists don't have very high criteria to get on the list. So just because it's on the list, maybe be a little careful. But those are really, really big programs. Again, I'm going to use the example of that Strengthening Families piece again, the life skills training. They have been studied over and over and have proven to be effective over multiple populations. Then we have research-based and promising approaches. So this program is based on sound theory informed by research. And then we think this will work because we're using some of this research space. We just need a little bit of time to prove it. So maybe some of your more grassroots programs, approaches. If you have been with us in Communities That Care, I'm going to talk about the social development strategy quick and talk about we're going to talk specifically about social development strategy and how you can take that strategy and implement it into something you're already doing. So that's an example of taking some of that research-based theory and strategy and implementing it into something that might not be on a list somewhere. Best practices are, we like it and we've done it. If you've had a coalition running since 1995 and every year you're out there at, the yearly carnival, setting up a booth, handing out information, people expect you to be there. This is something that you've done. You may not be spreading too much information or making that big of an impact as far as prevention, but you're making these connections and you're letting people know that there are resources out there for those who need it. Where we really have to watch again is there are programs out there and there are still programs and initiatives out there that are ineffective. So you're putting all this money, time, resources into a program. It's not effective. And then we still have programs out there that are harmful. Again, good intentions, folks really want to help. We're just finding out more and more with the research that some of these things are having the opposite effect of what we're looking for. And a big example of that are those scared straight programs, are those, anything that trying to instill fear into youth. And kind of going back to the middle, best practices are, those one-off assemblies. You see kids in the audience, they're very moved by a speaker. They may be crying, they may be relatable, which is effective at the time. But what we're looking for is a follow-up. So what happens after they leave that auditorium? Is there going to be a discussion about it? Are they going to be implementing that within some of their programs? So just as I know that's a really big example that happens a lot, not saying don't do it. We're just saying to really, if you have limited resources, which I think most of us in prevention have, you really want to put it towards those things that have been proven to be evidence-based and effective. And as always, that's what we do. Definitely talk to us about some of those things if you have questions. So where we're at now in our history lesson, we are looking at a risk and protective focused prevention. We want to see those signs of things that are happening. There are signs and there are steps when someone is going down that path of going towards a problem behavior. So we want to work on those things before they turn into problem behavior. So we're addressing the predictors. So research over the past couple decades, there are factors that elevate the likelihood of a problem behavior. Now, we're not saying that if your student is, not going to school, a couple times a month, that they are definitely, absolutely going to end up with a substance misuse disorder. That's not the case. We're talking about probability and likelihood with these things. So, and we'll look at a couple examples a little bit down the line, but talking about these things, we're looking at predictors. And we're not just looking at the bad stuff. We're not just looking at the risk. We're looking at protections that enhance those level of risks. We don't want to just look at risk. We want to look at protection too. So you have that balanced approach. If you're just looking at risk, it doesn't mean too much unless you're looking at that buffer as well. We're also looking at different contexts. So we're looking at the individual. We're looking at their peers, their school environment, and their family environment, and also communities. So we're not just limiting ourselves to maybe some intrinsic traits that students have had since birth. We're looking at the different areas that focus on every youth's life, not just keeping it down to, we need to fix stuff in the school, we need to fix stuff in this community, we need to offer this, looking at a holistic approach to the youth. there are a couple risk and protective factors that actually predict different behavior problems. So it's not just linear, like this may affect this, it's this may affect this, and this. So it's a lot easier to focus on those risk factors than to go to these bigger problem behaviors. Again, develop interventions to change those risk and protective factors is really what prevention is all about. That's what the latest research is, and that's really what prevention science is all about. I'm going to talk to you quickly about the Prevention Science Foundation within CTC, and then Jeff's going to talk a little bit more about, well, how do we put this, the foundation, really into practice so that we can move forward in making our communities as healthy as they can. So the Prevention Science Foundation for this CTC, Communities That Care coalition model, is the public health approach, the risk and protective factors, social development strategy, which we really just talked about, I'll repeat again, the Pennsylvania Youth Survey, or our data collection, and then those evidence-based programs, policies, and practices. So we have gone over this a lot in the context of prevention science, but we're going to talk about how those things relate to not only the Communities That Care model, any sort of prevention model that you are using within your community. So Foundation One, this may be familiar to some folks, but the public health model, it's based on predictors, based on that research. It modifies predictors to prevent those problems. It can affect a wide range of the social environment, which is really, really, really helpful when we're looking at those, the social environment moving forward. Again, it's about the environment that the kids or the adults are in, works through collaboration, and can create long-lasting results. So sounds like all the things that we are hoping to achieve as a coalition within the community, hoping for healthy youth. I'm just going to give you a little bit of an example here. We've been using this example forever, but it's so helpful. So when we talk about the public health approach, we're talking about defining the problem. So for this example, our problem is going to be lung cancer. So we want to work kind of backwards and think, well, what can we do to reduce the number of folks who are getting lung cancer? What can we do? What different strategies can we talk about? So when we're talking about risk and protective factors, which I have to admit that I don't have a protective factor in here, but when we're looking at these things, instead of just going and focusing on that problem of lung cancer, or in our case, depression or anxiety is what I'm going to use, identifying those risk and protective factors. So for lung cancer, it could be smoking, poor air quality, secondhand smoke. Any protective factors would be like healthy eating, exercise, any of those things. So how can we intervene on these risk and protective factors before they become become lung cancer? So a couple different things are listed here: cessation classes, limited advertising, increasing the price of cigarettes, limit smoking areas, and educating the public. The thing I really want you to note on here is that it is not just one thing or one person or one entity or one sector who is working towards this issue. We're looking at cessation. So educational classes talk about how smoking is harmful. We're talking about limited advertising. I'm not going to age anybody, but there were cigarette commercials, I feel like not that long ago. But limiting advertising, you're not seeing as much of that anymore. I hear smokers complain about the increase in the price of cigarettes. There's a reason for that. Limit smoking areas, just generally educating the public, and just keeping up with that information. It takes, I think Jeff's going to talk about sectors, but there's so many different parts to this puzzle, so many different pieces that can come together and help with these huge problems. And something like lung cancer, and if we're looking just at the intervention of reducing smoking, that's happened. It's something that we made happen. A lot of times these prevention efforts are things that take a long time. That makes it a little bit difficult. It can be a hard sell sometimes, but we're making these huge improvements within the community. So it's nothing that we do on here is going to be a quick fix. So program implementation and evaluation, how do we know that we did our job? This is the piece that was missing back when we first started talking about prevention. How do we know that we're doing a good job? We can't just gloss over and pat ourselves on the back and say, we did it, because, kids are sad in the assembly, or they know more about drugs and alcohol. We really need to make sure that we're tracking these things and kind of monitor and adjust if things aren't working the way that we'd like them to. And there's absolutely nothing wrong with that. So the next thing on here, again, are our risk and protective factors. I'm going to talk a little bit about this, but this is a good picture to just show that balance between risk and protection. It is really, really easy. And, I catch myself doing it a lot, but it's really easy to just talk about risk factors. That's what people are more used to hearing. That's what they're kind of more comfortable with. But we need to talk about those protective factors in a place as well, because if we don't have the protective factors, focusing on those risk factors really isn't going to do much. So I'm going to put this up here. It's a little complicated if this is your first time seeing it, but these are the connections to the to risk and protective factors according to our big survey instrument, the big place that we're getting data from, the Pennsylvania Youth Survey. So what I want to show you is it's the risk factors are balanced out into 4 categories. So we're looking at community, family, school, peer, and individual. Again, we want to make sure we're looking at the whole context of youth, everything that can affect them moving forward. So under, and then up here we have the 6 problem behaviors that Communities That Care hopes to prevent. So we're looking at substance abuse, delinquency, teen pregnancy, school dropout, violence. And then our newest one on here is depression and anxiety. So when we're looking at these, you'll see some dots here, dots and circles. Wherever you're going to see a dot and a circle is where there have been 2 or more studies to indicate that there can be a connection between those. So if we look at something like under the family domain, if someone is exhibiting signs from poor family management, they are more susceptible. Doesn't mean they're definitely going to hit all these things. Definitely doesn't mean that they're going to have all these issues, but they are more susceptible for all of the 6 that we talked about. So all of those problem behaviors. If we take it on the flip side and we look at, we kind of want to go backwards and we want to look at something like school dropout, we can go down this way too. So if we're looking at school dropout, we see that's a problem in our community according to our school data, according to the PAYS data. We want to look for what are the signs of possible school dropout. On this list, it's not everything. Everything doesn't connect with everything else. So we're looking at family history of antisocial behaviors, poor family management, family conflict. We go over to this side, academic failure, low commitment to schools, and a couple more here on our peer and individual domains. So again, this can be a little overwhelming once we start this. The way that we get the majority of this information, well, how do we know that they have poor family management? Are the families calling in and saying, hey, we're having problems managing this family. We're having, problems within our family structure. Most of this information, I should say, all this information on here, we can get from the Pennsylvania Youth Survey, and then we can back it up and, provide other examples and resources through other data within your community, which I'll mention. So don't worry about reading this too much. Don't worry about memorizing it too much. You will receive it. But when we talk about risk factors, this is what we're talking about. And those 6 problem behaviors are what we're talking about for our problem behaviors within CTC. On the flip side, again, got to make sure I talk about protective factors. one of the videos that we asked that you watch was around the social development strategy. I know some of you are familiar with it. Some of you may not be. I really encourage you, I'm going to go over it quickly, but I really, really encourage you to watch that video. It's on YouTube. It's David Hawkins, one of the founders and developers of CTC. He does a great job talking about it. But what the social development strategy is it's a way to organize those protective factors. You know, a lot of times there's not programs, kind of quote unquote, to enhance protective factors. They're more kind of strategies. So this is a strategy that you can use that helps organize. So here we're looking at it's all about bonding. So what we're trying to do is getting a youth bonded to their school, community, peer and individual, or their family. So we're looking for that positive bonding experience. So how we get that positive bonding is any of these domains here can offer opportunities for youth, can offer the skills to be able to do those opportunities. If you ask a kid, if you ask somebody about, you know, hey, can you go help so-and-so tie their shoe? You know, seems empowering at the time, but you have to wait a minute and say, well, like, do you know how to tie your shoe? And how can we help you with that? But before asking a youth to do something, making sure that it is appropriate for their age, their skill set, and providing them those skills to set them up for success and not setting them up for, you know, to make something a little bit harder. Big thing in here is recognition, you know, recognition of their achievement. That can be, you know, we hear a lot, you know, a trophy, they get a trophy for everything. It's about meaningful recognition. Even if you're saying thank you, you know, I would say thank you to Jeff for helping me find the annotate button earlier today. You know, just instead of saying thank you, really make it meaningful, because those recognitions are going to, and again, this is a full day training, just like a lot of other things we're talking about, but that recognition is going to lead to bonding. I forgot to mention too, when we're talking about opportunities and skills, keeping in mind individual characteristics. You know, you don't want to invite a student to, hey, can you jump on stage quick and, like, you know, do a little dance for your school or say a little speech. That is not going to work for every kid. Absolutely. So it's about individualizing these things. Yeah, I guess not Jeff, although I find it really hard to believe. So making sure it's according to the individual, according to, you know, their skill set, you're going to create that bonding. Here's where it could go wrong. This is where it can be flipped. Gangs offer these things too. They offer opportunity, skills, and recognition, and then you're bonded to that gang, right? Here's where the difference is. The clear standards, you know, this is what we expect from you. And since you're bonded to me, you're going to listen to me for the most part. I was in juvenile justice. I ran 2 juvenile justice programs. At first, before I knew better, I expected the kids to just come in and listen, right? Come in, listen to expectations, listen to our ground rules, and then we're all going to be happy and move forward. That's not how it works at all. And I would have to kind of warn my staff that, you know, they're going to come in and they don't know who you are. They don't have that bond with you, or they don't have that bond with the after school center. I was at a Boys and Girls Club. It takes a lot of building of those bonds in order for them to listen to your clear standards and lead to those bigger healthy behaviors. I know a lot of this happens already, but this can be applied in so many different ways. Again, please watch the video. We will talk more about it. We also offer this as a separate training, just to talk more about examples and talk about how important it is not to skip any of these steps in what we're doing. So these are just like the risk factors. These are the protective factors. Talking about those different elements from the social development strategy, how we develop those healthy beliefs, clear standards, how we develop bonding, how we develop opportunities, skills, and recognition. So kind of unfortunate that there's a lot less protective factors than there are risk factors. Maybe that'll change sometime. We'll see. I'm just going to mention this briefly, but the third foundation here is the community assessment tool. So how do we know what the issues are in the community, and how do we know that we are continuing to make forward movement? So one of these tools, our biggest tool in Pennsylvania, is our Pennsylvania Youth Survey. As I mentioned, Phyllis is going to talk a little bit more about that tomorrow, but it's really our assessment tool. We're asking the youth what their beliefs, what their perceptions are of their world around them, coming from those areas of communities, coming from schools, coming from their families and their peer and individual. How are they feeling about things? Are they engaged in maybe some risky behaviors? Are they engaged in some great protective factors? But we're hearing directly from the youth anonymously about generally what is happening within the community that's specific. Pennsylvania is so diverse. We do have a state level report, which is up on here, but we don't want to just look at the state level report and say, oh, well, this is the highest for the state, so that means that's what we have to focus on everywhere. That's not the case. From school district to school district, that could be different. From county to county, that could be different. So this is a really great self-reporting tool to find out what's going on in your communities. We usually try and start with this when we're looking at what's going on within the community, but then we also have more data to back it up. So some other data we might be looking at to assess our community and see what's going on in our community is any data from the school. One thing that we looked at was the school dropout. We may look at some of the school records for that. We may look at some crime statistics. We may look at, a lot of times the local hospitals have to do a needs assessment. So, not only utilizing the PAYS, but also those things, focus groups, anything else that may be helpful within your community to assess what's happening. Evidence-based strategies. This is just the level of confidence that what we're doing is going to work. So talking about those lists, talking about those strategies, that's one of the huge foundations. Once we find out what's going on, we want to make sure that we have a meaningful way to look at those things moving forward. So I know that there have been some questions throughout. Thank you, Jeff, Phyllis, whoever else for checking those. I was trying not to look at the questions because I was curious, but thank you for looking at those. But before we move forward, before I pass it over to Jeff, what questions do you have about prevention science? If it's something that is, we can quick write you back in the chat, we'll do that. If it's something that's a little bit more detailed, we can certainly, get in touch with you, send you more information. But again, you will receive this PowerPoint. You will also receive all the materials that I have been referencing throughout this. Let me give it a minute.
And if someone's typing a question or whatever, Megan, can I just jump in really quickly?
Yeah.
Just one of the questions that Christina posed was about, she was asking about school districts not sharing their data or what that looks like. And she was actually, we just found out, was referring to Philadelphia. Philadelphia does not currently participate in PAYS. However, we are working with local folks to help work on that situation. And I just wanted to let everyone know that not only do we provide assistance and work with your coalition, but there's also a team of folks who will help you work with your districts directly around utilizing the PAYS, sharing the PAYS, and really helping you, because that is one of our strong foundations. But also we can help you if you don't have the PAYS. Currently we have about, oh goodness, a little under 420 of the 500 school districts participating. So PAYS is pretty prolific. There's probably some somewhere in the world, in your coalition world. But if you don't have that, we can also help you understand data in a different way and maybe find some other alternatives to use. So I just want to kind of throw that in, and thank you, Christine, for that a question.
Yeah, I can represent a number of schools that if there is a way that those individual schools could get pays, they would give it. You know, they can get this. Yes. So
we've been working, Christine, for Jeff Colchin, I don't know,
yeah,
a decade, trying to get them on board. And, you know, we feel like and we have heard that before. The schools are willing to do it, but the system is not ready. So we're hopeful that with some of our local work, and we may, you know, we'll be looking to our partners in Philly to try to work on that for our 2023 administration. So fingers crossed, everybody.
All right.
Thank you.
Thank you.
Thanks, Phyllis. Thanks, Christine, for that. Jeff, you unmuted. Does that mean you had a question? Or
No, I was just going to ask if we were ready to move on. I see we have about a half hour left because I want to allow some time for question and at the end. So remembering back to our ground rules, I am going to try to hit the main points from each of these slides so that we stick to the ground rules of being done on time for you. But at the same time, I would like you to, if there's something that comes up that maybe I don't cover, or you have questions from the things on the slides, please feel free to put it in chat. I'm going to allow, I hope, about 5 minutes at the end for Q&A today, and we'll also have some time for those things tomorrow. So if something comes up that you want to ask about, we can revisit that either later today or tomorrow. So we're going to dive into some elements of the CTC framework next, which I think hit on, Megan, I loved your activity at the beginning where we talked about expectations and the things that folks wanted to learn, because I think you covered a ton of those in prevention science, and we're going to dive into some high level information next here. So if you could move us to the next slide. Does anybody here on the call today think that Megan, Phyllis, and I sat in a room somewhere and created communities that care to solve all of our problems through prevention in Pennsylvania? Raise your hand. I hope I see nobody's hand because you're giving the three of us. Maybe these two can. I am not creative enough to come up with a program that is this efficient, this flexible, and this good at preventing problem youth behavior. CTC has been in use in Pennsylvania since our slide says 1994. You'll see in a couple of slides. This first slide is meant to show you, now we recognize not all of these dots are exactly where they're meant to go. So they're close to your site if you're a CTC site, but it's really meant to show you that communities that care is happening all across the state. Sometimes it feels like there might not be another mobilizer for 50 or 100 miles from you from where you're at. If you're in some of those areas we see in the top northern part of the county or the state, for example, there are a lot of other folks doing communities that care across Pennsylvania. Megan, if you can move us to the next one, we'll take a little bit of a zoom out. This is what CTC looks like across the entire United States and Canada. You can see blue dots for historical CTC sites doing it in the traditional manner. The yellow sites are what we call CTC Plus now. And this is kind of showing where CTC exists across Pennsylvania or across the entire country. We see a concentration in Colorado. They had some new funding from new sources of tax revenue. I assume many of you know what I'm referencing just in the last few years. So they recognized pretty early on, they needed to put in place prevention efforts, and they've been really ramping up their CTC efforts. We see places like Michigan, especially northern Michigan and Utah and Oregon and Maine with lots of communities that care sites also. Megan, if you can move us forward one more. We're going to zoom out one last time and see the entire world. Now, it's not just a United States thing. We see sites, I'm going to read at the bottom, but Australia, Canada, Chile, Colombia, Germany, the Netherlands, Sweden, the United Kingdom, and of course here at home. We have the opportunity as CTC coaches to meet with CTC coaches around the world. I think it's about every 6 months. It might be every 3 months that I kind of lose track of the time. Whenever it shows up in my calendar, I go. But one of the really neat things is there's not a convenient time to meet with everybody in the world who's doing CTC. I remember one call, I think it was 4 or 5 p.m. here a couple of years ago. The gentleman in Australia, it was 2 a.m. there. He was standing outside of his house with a lantern. He got on the call because it's so broad, so vast, it's being used in so many places. There's not a convenient meeting time for everybody, but we do have that opportunity to exchange ideas and what's working and learn from other sites as well. So next slide, Megan. So in Pennsylvania, you've heard us say a couple of times today, CTC was adopted in 1994. It was developed by Dr. Hawkins and Dr. Catalano, and it's managed through the Social Development Research Group at the University of Washington. Long story short, they were working on their doctorates and they wanted to see what was working with they were probation officers. They wanted to see which programs were working and which ones weren't. They recognized that we have limited resources and we want to use the programs that are working for our youth. What they found from their study was that not only were none of their programs effective, some of them, as Megan mentioned earlier, sometimes our programs can cause more harm if they're not done the right way. The programs they were using were either not effective or they were causing the likelihood that youth went back through their probation programs again to be increased. So they changed their focus, and instead what came out of that was the communities that care process to reduce problem youth behavior. Pennsylvania, we have approximately 130 sites doing communities that care. About half are functioning right now. Can anybody, either using chat or feel free to unmute, tell me why are only half of the sites currently functioning that have begun using CTC at some point? What's the biggest reason why sites don't continue to operate? Funding. I see Kayla. Thank you. You get the award for putting in chat first because it showed up. I don't think any of the rest of mine will show up. I would have to go to Phyllis and Megan to look at the chat box for me. But yes, funding is not only super important, it's sometimes super challenging. So we, with our team, Megan and Phyllis and I, host every single month except June a learning community call. Unless something comes up that we would not have one, but we try to 11 times a year have a learning community call, and every year that is one of the topics that we cover to help share our ideas with you, some of the things that we know work. There's some information in the Communities That Care Plus material, as well as learning from one another. So it's important, if those are things that you're seeing, either maybe you're doing really well in, or there are areas that you would like to see strengthened in your coalition, attend our calls. We love to share that information because you may be doing something that Megan and Phyllis and I know nothing about that can help a ton of other folks across the state, so we can all better our prevention efforts and ultimately do better for the youth across Pennsylvania. So having that yearly learning community around funding is important to us for that reason. Pennsylvania is a little bit unique in that we have ourselves here at EPIS, dedicated technical assistance for the Communities That Care sites. I don't think there's, and Megan and Phyllis, correct me on this, I don't think there's another state where if you have a question about your coalition functioning or about Communities That Care, I don't think you can pick up the phone and call one centralized location like we have here at EPIS for Pennsylvania. We're pretty fortunate, we're pretty lucky to have these resources, and those have continued to evolve over the last more than a decade now. In Pennsylvania, because we have so many sites and because we have dedicated technical assistance, we have a great history of studying the process, and we have the opportunity to study Communities That Care on a long-term and large-scale implementation under the real-world conditions. Megan, if you will move us to the next slide. So somebody asked early on, I think it was in the chat, for the expectations about the philosophy of CTC, and Megan did a wonderful job earlier covering those foundations, or sometimes we call them the pillars of CTC. What we have here on this screen kind of covers that information as well around the philosophy. You heard Megan talk a lot about using the public health approach. CTC is all about using the public health approach to prevent problem youth behaviors by reducing risk factors and buffering against and increasing those protective factors. The process is community owned and operated. Here's something you will get tired of hearing us say. It is Communities That Care, not the mobilizer who cares. The process is meant to be owned and operated by the entire community, led by a coalition of stakeholders in the community from across all sectors, or as diverse from the sectors as you can make it. And we're going to see those sectors here in just a few slides. The process is data-driven. The community makes the decisions using their own data. And an example that was explained to me when I started in this process, my trainer at EPIS at the time, whenever I was a mobilizer, she was from Center County. And she said, Jeff, Center County has really wanted to reduce underage alcohol use, but we really needed to look at it in a couple of different ways. In the rural areas of the county, and some of you that maybe live in rural areas of the state see the same thing, youth were going and having bonfires in the middle of the field somewhere. In the area around State College, it was more getting the alcohol from their older siblings and other, college students. So the ways to tackle those problems, it was the same problem that they wanted to reduce, the problem behavior of the underage alcohol use, but they needed to use their own local data in each of those communities to see why those things were occurring. So in CTC, it's great to say, here's the PAYS data for the entire state, and then, or here's the PAYS data for our county. And if that's all that you have, that's use the best that you have. But where it's available in your own school district, as Phyllis was talking about earlier, using your own local data to make the decisions, because that data helps you know what's going on there, and your community coalition members know what's going on there best. We use that data to adopt evidence-based programs. And then you hear us talk a lot about beginning with the end in mind in communities that care. We are outcome focused. We want to see reductions in community levels of adolescent risk-taking behavior, and we want to see improvements in child and youth well-being. So Megan, if you will move us to the next slide. CTC is what we like to think of as an operating system. And if any of you call it a program, Miss Phyllis Law will correct you. I think before you even get out the word program. Sometimes we use the word incorrectly. We think of CTC as being a program, but CTC is an operating system used to mobilize communities and better align agency resources while promoting positive youth development by reducing risk and enhancing protection. I will use an example here that my wife tells me is too nerdy and to stop doing. So if it doesn't work for you, you can be on team, Melissa, my spouse. And if it works for you, great, feel free to use this. But I like to think of CTC. Most of us are probably on a computer today. Many of us are probably on a Windows-based computer. Windows would be the operating system in that case. Some of you might be using a Macintosh computer with the Macintosh operating system. A few of you may be even more tech savvy than I am and using something like Linux. But if we make the assumption that most people are using Windows, Windows is the operating system on our computer. Right now we're using Zoom and Megan's sharing PowerPoint. Those are the programs that are making this training happen. We're using Zoom to be able to communicate all in this environment. We're viewing the slides that were created in PowerPoint. But Windows is in the background making sure that those resources, that the RAM, that the CPU time is dedicated where it needs to be so that everything runs properly. Because without that operating system, your computer might give all the resources to, I don't know, maybe Megan's has 10,000. I'm the one that usually has 10,000 tabs open, but maybe she has 10,000 tabs open in Amazon trying to get all of her shopping done. And the system would give all the resources there and we would not be able to use Zoom, or PowerPoint would probably not even open at that point. But really CTC is like that operating system, and then it helps us to manage those resources to the best way that we can in our community. As Megan said earlier, and I love this, none of us have unlimited time, talent, and treasure. So CTC and the model of communities that care helps us to use those limited resources in time, talents, and treasure in the best way possible so that we can see reductions in problem youth behavior in our communities. And if any of you have unlimited time, talent, or treasure, please stay after at noon today, because I would love to talk to you. I'll make that disclaimer and say nobody's ever stayed after a training yet and told me that they have unlimited time, talent, or treasure. But if you do, I'd love to talk to you. Megan, if you'll move us to the next slide. So every CTC site in Pennsylvania looks a little bit different. Yours may look like this if you already have a site, or if you're thinking about putting this in place, or it may look different. This is meant to show what the average site looks like. So if we look at the boxes in the lighter color, the white, we see we have the facilitator or coordinator. That is probably what many of you do for your coalitions. From connected to there, we see the community board. And from the community board, we see key leaders. So those key leaders are the folks in your community that the decision makers, or the people with power or influence. They don't necessarily have to have a fancy title. When we train for CTC Plus, you'll hear an example given of a lady in Maine that, and I forget her name, but she had no fancy position title. She had no money. But whenever she spoke, she was the person that people in their community listened to, and they thought, well, if she thinks it's a good idea, we think it's a good idea for the community. Those key leaders are those people that have that influence, or that maybe they do have the deep pockets that can help fund the things that you're doing. Usually the key leaders get updated about every 3 to 6 months, usually about every 3 to 4 months, but it can be less frequently depending on your community. They stay connected to the process, and when you need things, they're there to help you fill those needs. The community board is where the decisions are made for your group. We talk a lot about how it's the communities that care and not the mobilizer or the facilitator that care. That community board is really the ones that bring, hopefully they represent the diverse sectors, and they bring the information about your community to the process to allow the flexibility in the process to be applied to your community so that the decisions can be made that represent your community in the best way possible. Now, we see to the right of there, usually there's an executive committee tied to this community board, things like the president or chairperson or vice president, vice chairperson, secretary, and treasurer. Underneath the community board, not every community group has 6 work groups. Some of them are combined. My old coalition, when I was a mobilizer, had 5. 2 of them were combined. But we see the work groups listed here, and we're going to go into a little bit more detail in a few slides about those. Now, your community board structure may look completely different to this. Some of you probably are in a group that's maybe a 501c3 or represents a group that's school district size. Some of you may represent a group that's several school districts in size. Some of you might be tied to a group that's county-wide or several counties wide, and maybe you're a part of the county government. So the structure can really depend on the area that you serve, the role in the structure, whether you're a nonprofit or you're tied to the county government or maybe tied to a school. It may look very, very different than this, but this is just meant to show you what the sample looks like. Does anybody have any questions about this board structure before we move on? All right, please move us to the next slide, Miss Megan.
Can I just make one little comment?
Sure. Can you go back to?
I'm sorry, Megan, I couldn't get unclicked fast enough. One of the things to keep in mind, and Jeff, you did a really nice job going through the overview, is to really think about what the functions of your coalition are happening and how these committees may ebb, flow, whatever that may look like. I cannot stress that enough. While you may not have a committee or work group or action team or however you want to classify your working groups, right, that is called the risk and protective factor work group, it's important to remember that it's about having your coalition understand the functions that they need to be doing so that the work can get done, and really positioning these groups in the space that we're not just going to meet, because a lot of times when you say like the word committee, people run for the hills, right? But letting them know and ensuring that when you start working in this space with these committees, that these meetings are very work focused. People feel they are bringing something to the table, taking something away, feel very interactive and engaging, and getting the right people on those committees. We are asked a lot, how many people am I supposed to have on these work groups? Well, I would rather have a few highly active and engaged folks than 50 people on a name who never show up, or on a list who never show up. So I just kind of wanted to, Jeff, just really kind of reinforce that. Because your coalition may not be operating exactly the way this is designed, which is okay, but it's using the science of what we know needs to happen for your coalition to be successful. So does that make sense? Thank you, Jeff.
Yeah. Great, thanks, Phyllis. Megan, if you can move us to the next slide. So what we see next, Megan hit on earlier about, really diversifying the sectors that are engaged. I think I've done this presentation once. Okay, I like how they all pop in here. I think one time I did it, they were each like one of those time bubbles, so that like each popped in and it grew. But this is meant to give you a snapshot of those sectors that you want to think about when you look at who's at the table representing your coalition. You may look at this right now. Maybe you have one of those coalitions that started in the mid-90s and you think, you know what, there's some of these that I don't have. This is a great opportunity for you to look at. Feel free, if you want, with your camera to take a snapshot of this, or Megan, of course, will get you these resources when we're done, to think, is our coalition diversified and representing all of these sectors? Outside of that, think about maybe you have somebody from all of these sectors that attend your coalition, but you're a countywide agency. Are all the people that are from your coalition representing your coalition, are they just from maybe the county seat? Do they represent everybody, all areas geographically of your coalition? So as we look through the sectors here, we see, I'm going to start kind of top, middle, and work my way around. City and county government folks, children and family services. Sometimes we could see this called other youth serving agencies in some places to the right of that. Family and family groups. We see media, and that's one that not everybody has at the table, but media can be a big help for some of the work groups that we're going to talk about next. Youth, do you have youth at your table to be able to share their view on the data and tell you what's going on from their perspectives? Law enforcement, the faith community, mental health, community service organizations, the health department, businesses. Do you have businesses at the table? Not only to as potential funders through to some of the things that you want to fund for your group, but also they want to see the best people be employable in the area that they do business at. Some businesses right now are struggling to find somebody not only that's qualified, but that can pass a drug test, for example. So they have a vested interest in what you're doing. And also the education sector. Can anybody think of any sectors that aren't here? If we go all the way back down to the bottom right, Megan has one here for us with question marks. Does anybody know of, or does a sector come to mind that we don't have on our list that either you have at your coalition now or you'd like to bring to the table? Legal, that's a great point, Erica. Whether that is having them there for full participation or possibly making sure you have somebody on retainer, for example, as services come up, but they may know of things that are happening that the other sectors wouldn't as well. Great. Federal government. Oh, great. Angie, their board president is a lawyer. At my old coalition, when I was a mobilizer, one of our board members' spouses was the former DA. So while he wasn't directly a part of the coalition, we knew if we needed something, we could turn to him from the legal perspective. Great. So these are some sectors to think about. Are you engaging all these sectors right now? How could involving the ones that maybe aren't at your coalition's table right now, how could that strengthen the efforts that your coalition is working on? As well as thinking about all the other things that exist in terms of gaps. Are all the geographic areas covered with your coalition? Are all racial groups within your community, do they feel represented? Do they feel like they have a seat at your table? If you take your coalition and you put the board members in a picture, if you expanded that out to represent the entire community that you serve, is it an accurate representation? Would everybody feel that they're represented? And that's a rhetorical question, but if you have those things that you want to talk through with us, please reach out to Megan, Phyllis, or I. Megan, I think we're ready for the next slide. So I think we just have two more, and I will try to be brief. This one is, if you remember back a few slides ago where Phyllis helped to share some additional information, we talked about those work groups. These are those 6 work groups, and I'm going to go through very, very quickly some of the chores, the task that each work group does. But I will also say, if you have questions about these, this is a different, Megan talked before about how these are longer trainings. I have a presentation that each work group has 2 or 3 slides of their own to talk about in detail. What are the skills that they need to bring? And what are some of the tasks that each of those work groups does that we can talk about in more detail, either individually or with your coalition, if that adds value. So the first is that risk and protective factor assessment, sometimes called the data work group. You'll hear Phyllis talk about PAYS tomorrow, and Megan talked about it several times earlier today. This is usually the group that will review that PAYS data that comes out every other year. It's administered in the odd years. The data becomes available about April 30th or May 1st of the even numbered years. So that will be available hopefully early May next year. This group helps to look through that whole report and refine things down to say, here are the risk factors that we really need to focus on. We can't focus on everything. In the Communities That Care process, if you're a CTC site, my old coalition hated icebreakers. Megan loves them. So I knew not to do this when I was a mobilizer with my group, but there's an activity where it asks the mobilizer to blow up a whole bunch of balloons and bring them in. And if you can picture this, having your coalition members stand around and you keep throwing balloons into the middle and they have to bat them up in the air. At some point, balloons start hitting the ground. Maybe you have 10 coalition members standing around and they can keep 5 up in the air, but when you introduce the 6, they start falling. After they see it happens a few times, those balloons start hitting the ground, then you pull out only the red balloons. And you're only supposed to have 2 or 3 red balloons, and you throw them into the middle of the circle. And your coalition members can probably keep those 2 or 3 balloons up in the air. This work group helps to see what are those risk and protective factors that we can meaningfully make change in our community to reduce risk and enhance protection, because we can't focus on everything, or we're not going to be focused on anything. That group will provide that information usually to the entire board, but then also to the next work group down that we see, the resource assessment and evaluation work group. That work group is responsible for doing an inventory of all of the efforts that are happening in your community. And I say community because everybody's definition of community may be different on this call today, but the community that you serve, knowing what are the other groups out there that are doing prevention programs, especially around the risk protective factors that you're targeting, identifying the gaps that exist in those, whether they're gaps in maybe nothing addresses the risk and protective factors that you see as most valuable, or maybe there's gaps in things like age groups or geographic areas or other gaps that exist in your community. This group will help to find those, report those to the board, and then find the appropriate programs, policies, and practices to fill those gaps. They're usually involved in evaluation as well. The community board maintenance work group, just like all of us are different, everybody in your coalition brings different values to the table and different skills. The community board maintenance work group does things like establishing bylaws, and usually they vet out the new members for the board. Some people love bylaws and some people would never want to be on a work group that is involved in making bylaws. So everybody may have different interests, and that's why this process works so well. The next work group is funding. We just talked about how important funding is to making sure that the work continues to happen in your community, that you can fund all of the prevention programs that your community needs. They may help or assist with identifying grant opportunities or potentially writing those grant opportunities, creating a long-term funding strategic plan to make sure that our efforts happen long into the future in your community. The 5th group is the Community Outreach and Public Relations Work Group. And long story short, this group takes all those great things that are happening and makes sure that the community is aware of them. I hear so often, we've been doing this, we put the word out, but people in our community, they still don't know what we're doing. There's an entire work group that's dedicated usually to this process to make sure that all the good things that you're doing, that story gets told to the community so that it helps with things like funding. It helps with recruiting new members to your coalition. It helps with so many different ways. The community should know the great things that you're doing in your work group or in your coalition. And the last work group is youth involvement. And this is things like identifying a youth group that already exists and working with them, or creating your own youth group to work with the coalition, finding ways to involve them, things like having them analyze the PAYS data and see what are their thoughts on what the data tells us is happening. But they can be involved in your coalition in so many different ways. They could be involved in every work group in theory. And some coalitions right now are doing that. Some are still working on getting comfortable with their youth group to invite them into those other areas of the coalition. The last slide, if you will move us forward, Megan, is the phases of CTC. And we heard Jeff Colchin at the very beginning of today talk about how this is a cycle. You go through it and it keeps going, like a wheel rolling down the hill. It's a process that doesn't really have an end. So I'm going to run through the phases kind of briefly for you, but please, if you have questions, maybe you're thinking about where you're at in this process right now, I would welcome those. Phase 1 is really about getting started and identifying readiness issues in your community. Do you have a data source, for example? Does your community do PAYS, or do you have another data source that can help you to make the decisions that you need to for the CTC process? Do you have folks that can get behind this process as key leaders, or as a champion or a catalyst? And we can help you with all those definitions. What is a champion versus what is a catalyst? But phase 1 is really about getting started and making sure that your community is ready for the process. Phase 2 is organizing, introducing, and involving. And this is the big activity in this phase is training that community board that you form. Hopefully a diverse community board that represents all those sectors from a few slides ago, that fills in all the geographic areas of your community and everybody feels represented, and training them in things like prevention science and introducing them to the communities that care process. Phase 3 is developing a community profile. And in this phase, that data work group is very active at looking at the data and seeing what it tells you for your community, identifying the risk and protective factors to prioritize, and then having the resource assessment committee analyze that data to see what are the gaps that exist and filling those gaps with evidence-based programs, policies, and practices. Phase 4 is writing a community action plan to say, here are all the things that we've done so far, documenting those steps. Here's what the data tells us. For example, here's the programs that we're going to put in place. Here's going to be who does those programs. Here's how we're going to fund that work, and getting it all documented. Phase 5 is implementing those evidence-based programs, policies, and practices, evaluating them and the community action plan. And there are many other activities that happen in Phase 5 in the CTC Plus training. That's where funding training happens and things like that. But you often hear us mentioning looking at it sooner as maybe in Phase 3 or the end of Phase 2. But there are a lot of Phase 5 activities that are involved with getting those programs implemented, making sure they're done with fidelity. I think our IS team will love hearing that today. And then evaluating to make sure that they're working in the way that you thought that they would for your community and that you're seeing the outcomes associated with them. And then we're back to Phase 1, making sure that your community is still ready for the process. Maybe the key leaders are the exact same, but are they still on board? Have you kept them updated? Is it the same people? And the process just continues in a circle. Hopefully for the long term, because these changes don't happen overnight in your community. Whenever I was in your role as a mobilizer, my trainer, her name was Elizabeth, she always told my community, the best time to plant a tree was 20 years ago. She would say, your community didn't plant that tree 20 years ago. You're planting it today. The second best time to plant it is today. So it doesn't matter if you've been doing CTC since the mid 90s, or if you're just thinking about getting started today. The best time to do it was 20 years ago. The second best time is today if you haven't already, to get these processes started. Megan, I think the next slide is questions, and I hope I allowed us just a few minutes for questions and answers today. Great, I thought I knew that slide. I was scared for a second after I said that. I ran through all that information relatively quickly. Those are all presentations that could be several hours in length. What questions do you have about the work groups or the phases, or anything else from the slides that I just covered, or anything that you had thoughts from Megan's presentation throughout today? Phyllis, you are muted, so I feel thankful that I wasn't the first one to do that today.
No, it's my day. I'll blame it on that. Not old age or anything else, you know. But I just wanted to say, I think y'all did a great job, and really remind folks that when we send out PowerPoints and do presentations like this, we really want you to, you know, take this information and use it in your own world. As Megan and Jeff said, these were very high level overviews. And this is the kind of thing that not everybody's going to need to know all the details and how deep we get. But I just really want to encourage, first of all, to thank my colleagues for doing a great job, but also to encourage y'all to really look at this presentation and think about it from the lens of, wow, how could I use something like this as I'm engaging folks around my table, and really encouraging those who are there to better understand the process and things like that. So I just wanted to throw that in. Thanks.
Great, Megan, I'm not sure if you were going to wrap us up, but I would love to say, if you think of questions tonight, please bring them tomorrow. As a reminder, we meet back at 1 tomorrow. We go from 1 to 3, and we're going to hear a lot of information from Miss Phyllis Law and again from Megan. And I loved your attendance today, how many people had their cameras on, all the great things that you put in chat. If you have any technology issues, please feel free to shoot me an email, and I will try to watch for those tomorrow as well.
just that we, echo Jeff. We appreciate everyone being here. We'll see you back tomorrow at 1 o'clock. Same Zoom link. If you have an opportunity to view some of those videos, if you didn't get a chance to before, take a look. Each video, I believe I put 4 videos on there. They're about 3 to 5 minutes each. It'll just help wrap up some of these concepts and be prepared to get into some group discussions tomorrow. But thank you all, and we'll see you tomorrow. Bye.
Bye, everybody.
Thank you.
We'll see what we can do. All right, we are recording. So we're going to talk a little bit today, and I mean a little bit as a very little bit. Like everything else yesterday, especially this training, the pays can be, oh, you know what? I realized I started us from the beginning. Pays can be a full length training. We at EPIS and folks at PCCD, I know, I can't find him now. Oh, there he is. I know Jeff Colchin's on the line too. He is the project lead at PCCD for the pays. But the state is really committed to having not only this measurement tool to hear youth voices, but also to make sure that that information gets used. It's not just sitting on a shelf somewhere. There is a team of folks who it's really their job, it's our job to go and make sure that this information is relevant, it's useful, and that people are able to take away the information and really make sometimes some hard decisions about what's going on. So now that I have the right one up, I'm going to share. And while I'm talking about this, anybody from EPIS, of course, Jeff Colchin, please pop in. You are the foremost expert in this. So by all means, at any point, please hop in. So we're going to take a couple minutes to talk about the Pennsylvania Youth Survey. I know that some of you are familiar, might be a nice refresher. Some who have not heard of it, there are a lot of really, really great resources online. There's resources with us, like I mentioned. So please utilize them. There's a lot out there. So the PAYS administration happens. It actually just closed. The PAYS was administered this year from about the beginning of September until about Thanksgiving. Some special provisions might happen if it's needed, but it's administered biannually in the odd years. So 2021, it was administered in 19, 17, and so forth. And that has been happening since 1989. So I say a lot that in so many ways, Pennsylvania is really the lead and at the forefront in a lot of this prevention work, in coalition work, and in data collection. And that's really, really exciting. The survey does not look the same as it does in 1989, of course. A lot has changed, but as much as we can, we try to make the survey stay really consistent throughout the years. That way, not only you're finding out what's going on that year, but how that compares to other years or other iterations in the PAYS. Sorry, I thought I heard that. Okay, chime in. Okay. So the PAYS administrator, well, we'll go to this next. What do you find in the report? Even though the iteration for the PAYS is again in the fall of that odd year, the full reports of all of the information comes out by April 30th of the next year. When we talk about full reports, we are talking about a statewide report with all of the data that's used. And keep in mind as well, this data is, anonymous, which we'll kind of talk about in a minute. The data is anonymous and it's also voluntary. At any time, schools opt in to take these surveys. There is no requirement. There's no requirement that individual students take the survey. either. It's all voluntary. So we have such a great participation rate, even though the survey is voluntary, it's not required. And a lot of schools and communities use it in a lot of different ways. And Jeff, I'm going to put you on the spot a little bit, but last time we checked, I know we were about 415 or so out of 500 school districts. Do we have an idea of what we ended up with?
We had 419 districts registered. We're still processing data, waiting for paper surveys to come back, and we're hoping to be somewhere right in that ballpark.
Great, thank you. So again, for a voluntary survey, that's really, really exciting, in part for the Pennsylvania, there's a Pennsylvania a PAYS advisory group who really does a lot of outreach. We, for the first time, have a PAYS coordinator through the state. Mostly that job has been lying, I'll say, on Jeff and Phyllis, with some help from others. But some of you may know Kelly Burke. She is now with Epicenter, and she is our newest PAYS coordinator. So very excited to have somebody full-time on the project, because it's a lot of work, during, after, before, the whole time. So we're excited. So the reports, again, are released by April 30th. We're looking at state level report, county level reports, as long as there are 2 or more reporting counties. The county reports are public only if they have 2 or more reporting counties, reporting school districts, excuse me. And, that's really important talking, when we're talking about anonymity. We really want to ensure that, this data is being used in the right way with the right people. And the school district reports are not public information. The superintendent or PAYS administrator within the school will be the ones who would get that school district level PAYS report. And it is up to them how they want to share and release that information. Now, us as prevention folks and folks in the community, a lot of times, we'll make that connection with either the PAYS coordinator or the superintendent, whatever that looks like, and talk to them and let them know how, they would like, how you would like to use that information, how you can assist them in helping with that information. But again, it's at the discretion of the superintendent or the coordinator. But we're seeing a lot more instances where, the PAYS isn't just going on a shelf, it's being shared with the community. Just because the PAYS is being administered in the schools, that doesn't mean that's all we talk about. Remember the 4 domains from yesterday, the family, school, community, peer, and individual. There are questions throughout the survey on all of those things. We like to reassure the schools that, this isn't all in the schools. The school questions in the PAYS are a little section, but not the whole ones. And I'm sorry, Christine, did I hear you speak up?
I'm trying to get back in the chat for everybody. So I don't know how to get out. Jeff is trying to explain to me.
Okay.
But I'm responding because, as somebody that does research, the statement that PAYS is given out to X amount of public schools is sending wrong data when we have hundreds and hundreds and hundreds of state-approved public charter schools who are not included and don't know how to get included. And so most of those students and parents are people that were not happy with the traditional school district or wanted something different, and they want to be involved, but they are not being tapped. So I got to be the voice for all of those districts in Philadelphia.
I appreciate that.
Right. In Philadelphia is one school district. There's another, I don't know what they're updated not, but there's 90 or another school districts as individual charter schools that would gladly participate in PAYS, but it's going to have to come from another level, because all of those people are prepared to have a voice, and they're not being, that's really a thing. I was trying to get in here.
And I should clarify too, this is not just for public school districts. You know, I know when we gave the number, we talked about those, but it's really, you know, it's private, parochial, charter. It
Right.
sounds like, and you know, I can let Jeff talk about this too. Sounds like maybe a little bit more targeted recruitment, because they are, you know, absolutely more than welcome and invited, and we really encourage it. But we'll just have to find how we can make that
I
happen.
will say, who's ever on here, when it comes especially to Philadelphia, I am Big Mama, I feed people. If you want to find a way to get an audience of people who would like to be a part of this, I will sponsor it, I will have it, and they will come because they want to get this data. We've met and talked about this. So please, whoever can do something, because that data, we can't even if we can just get the data from what you just did, but it cut out an entire population of people, which the research shows most of the people that chose to go to a charter school or faith-based school or whatever were not happy with what was happening and made a choice. And now their data is not in that data that you get. So I'm willing to help anybody. I don't know how to get out this stupid chat, but I'm willing to help anybody.
This is Jeff again. Thank you so much for that.
Yeah.
We did, I just pulled the numbers up. We had 4 non-public schools in Philadelphia. So that is definitely something that we want to work on for 23. We did have some ongoing meetings with the Charter School Association in Philadelphia.
Yes.
We had hoped to have a kind of a informational webinar in September. It just didn't get off the planning stages. So I think let's start early, let's start often. And I would welcome any sort of assistance you can do for exactly what you said. I mean, we have, I think the last count I had was about 60 non-public schools participate. That's charter, parochial, private, and cyber. But the more we can get, the better. I think you hit the nail right in the head.
Okay.
Go ahead.
Well, no, okay, but we need to change that because charter schools are public schools. They're just individual districts inside of this district. And so that's why that when you're showing that data, when I'm looking at the data and you say public school children feel this way, the data shows when the feds do a research with us, much different information because they are talking to the parents and the children in all of the quote public schools, publicly funded, which charter schools would fall under that as well. Right. So whatever I can do, I'm glad to help. I'm retired. I was formerly the state vice president of the Charter School Association. So I do have contacts with that, but we have talked about it at our charter school meetings of how we not only help and be a part of this process, but on regular basis, when we apply for grants, they ask for the PAYS data and we don't have it. So maybe we can spend this year getting everybody signed up so that this can be a picture, true picture when you have, you know, whatever I can do. I just want to be at the table.
100% agree and 100% appreciate that.
Yeah.
Christine,
you know,
yes.
Phyllis mentioned yesterday that there's a group of us meeting with the school district on Thursday. And Erica put her email in the chat. Which if you can't get to, I heard you say that, let us know, but that's us, we're meeting with them and that's our conversation with Phyllis. So please reach out. Thank you, Erica, for putting that in the chat.
Not a problem. I will gladly, listen, they know me down there, doctor, they all know me. So I'll come down there, bring some stuff.
We want that. We want that.
Not a problem.
Yes. Yeah, that's really great to hear.
Yeah.
Thank you for that. And I know, you know, again, it's progress, you know, we're definitely not there, but we want to capture, you know, as many communities as we can. And, you know, I know Philadelphia has been targeted for a while and we, you know, keep moving forward and making progress.
Right.
I appreciate that. Although I am giggling a little bit that you say that you're retired because I don't know how much of that I believe.
Oh, no. I am meaning I'm now doing more of what I want to do. I can say what I need because I get my check, so nobody can say anything. We charter schools are independently, they don't need to get permission from School District of Philadelphia to participate in your PAYS data.
Yep.
So unless there's something I know about, because I've talked to our state representatives and they don't understand why automatically, just like a small district in the suburbs, each one of our charter schools are individual state approved public schools that you can deal directly with that board to get permission to do the PAYS data at their school. You don't need the school district of Philadelphia to approve that.
Absolutely right. And we did, they were part of our recruitment.
Okay.
We do send it out through every administrator of a charter school or private school or parochial school, like I said, does receive notice that they're able to participate at no cost to them.
Yeah.
So, again, the more we get, one of the great things about the PAYS is that it's offered at no charge.
Right.
All we need is a half hour to 40 minutes of one class period from a school once every other year.
Not a problem.
And they can have valuable data that really helps them. And like you said, I think there's a kind of a disconnect sometimes where you say, if you want to write a grant, having data about your kids really helps make the case to a potential funder. So I think that's a strong selling point we need to focus on.
Not a problem. I'm there.
I think, Jeff, you just took some of the things that I was going to mention as well. But the really important part, and a lot of times we get the question, well, what sets this apart? Why should we do another test or survey or anything like that when we're already stretched for valuable time in school? And one of the big things that sets this apart is these are the youth taking this survey. We are hearing directly from them what their beliefs are, what their perceptions are about their community and the world around them. And that doesn't happen all that often. So that's what really sets this survey results apart. And the fact that it's been longstanding, again, since 1989, and a really good support group around it helps as well. So we'll look at those numbers. Our next iteration will be 2023, which when you're working on the PAYS, it comes very, very quickly. So we'll definitely look for, a growth in the number of those charter schools, whether they are public or private charter schools.
There's no such thing as a private charter school.
No such thing as a private?
Nope.
Okay. All right, public charter schools it is.
Mm-hmm. They're all public schools with public funding following the public school rules and regulations. They're just individual. What is hard for people to understand is a charter school is a school district. It may be just as one school or two schools in its district, but it is a public school.
Okay.
Okay.
Right, thank you.
No problem.
So there are a couple different, one thing that is new for this year that has also been really exciting besides getting Kelly on board is there was on December 1st, I know some of you are already familiar with these webinar calls. I'm going to kind of combine this and this, but the first Wednesdays at 1:00 are webinars all about PAYS. They're hosted by EPIS and PCCD. We have a number of speakers come in and talk about different areas around the PAYS. And the most recent one we had was 2 weeks ago, talking about a highlight report that was sent out to superintendents who participated in the PAYS and who participated electronically. We hear a lot of feedback that folks want to hear what's going on and don't want to wait until the end of April. There's a ton of information out there. It does take a little bit of time, but this year we were able to put together we should say Bach Harrison, our vendor, put up a report on the preliminary highlights for the superintendents. So just like, and again, this was not for schools that did paper pencil because it's a little bit harder to aggregate in such a short amount of time, but for folks who did the school districts and schools who did the survey electronically, the superintendents would have received that data on December 1st. So if you are interested in that, you haven't had a chance to connect with a superintendent, now would be a really great time to ask them about this information and if they would like to share it with you all. So again, there's a ton more I can talk about the PAYS. Please reach out to any of us. Please attend. Those first Wednesday at 1 webinars are for everyone. Please attend. We've had 3 at this point, and they've been really well attended, really great questions that are being asked. But there are 2 really great websites. Of course, PAYS, pa.gov, which is through PCCD, That's going to give you those public county reports, administration documents, and lots of other things. And then the EPIS site, we have our own pays tab. There is a place there to directly ask questions. If you don't know who to go to, as far as EPIS, there's materials, how do I use this information? Why is this information useful? And there's also registration when we're talking about things like the first Wednesday at 1 and any other trainings that would pertain to the pays as well. So are there specific questions about the pays?
Megan, can I put you on the spot with one?
No, yeah.
I think she's a little bit scared right now because we haven't rehearsed this ahead of time. But Christine, something you said earlier reminded me of a good question. So you talked about bringing youth to your meeting because, and I have 3 young ones at home, they're pretty honest about telling you what's going on, right? So sometimes as mobilizers or facilitators are doing the work that we do, you get asked questions like, so the kids like, they lie and stuff. So how do we know that the survey results are even valid? And Megan, I thought I would pitch that to you because I've heard you talk about the ways that the surveys are validated before, and you do such a wonderful job. So I hope it's okay to put you on the spot with that.
You could put me on the spot. Keep in mind, this was not my department until this morning. So that's a huge piece, and I'm really glad that you reminded me of it. So the validity checks, the biggest question that we get are, well, how do we know that the kids are telling the truth? Because, you don't have a teacher looking over your shoulder. You don't have someone checking the individual reports to see if they are being truthful. There are a lot of validity checks throughout the survey. There's a couple questions that are essentially the same question, but asked a little differently. There are questions that include a fictitious drug. If there is any point where there's some questions about any 30-day substance use and lifetime substance use. If their 30-day substance use is higher than their lifetime substance use, they're exaggerating on some end, and that's going to be pulled. We consider if 10% or below of the surveys are pulled because of validity concerns, it's still valid. This year and last iteration, I know we were under 2% for both. So we're finding out, if the youth are being truthful because of these different validity checks. It's different for different versions of the survey. So there's a lot of really great ways to tell. I mean, and letting, a lot of that work gets done up front too, letting the youth know this information is really important. We really want to hear what you have to say. And that no one is going to see or pull your one survey and be able to relate it back to you, because that's not the purpose of these. The purpose is to find out as a population, as a community, what the norms are, what's generally happening. It's not about that one-on-one, that gotcha, anything like that. If there is an area of concern for any individual student within the school district, that's why they have guidance counselors, a ton of resources, student assistant programs, but this is not the tool to measure those individuals. Thanks, Jeff. All right, we okay for now on this? I know it's a lot.
Megan, I'll put the link in the chat for the page on PCCD's website. The
Okay.
link that I'm going to share has, you can see Megan mentioned those years, 2019, 2017, 2015. You can click on any year and you can see some of those things Megan talked about. You can see the report for the state. You can see the county reports if your county has one available. And you can go into each report and see some of those things. Megan just spent some time talking about those validity checks. Each of those things are spelled out in the first pages on the PAYS reports. Please look through those and follow up with us if you have questions. We're happy to help.
Great, thank you. And you'll get this PowerPoint, you'll get the resource list, you'll get these links a bunch of times. If you don't already have them, you'll be visiting them a bunch of times as well. Thanks for putting that in the chat, Jeff. All right, so we're going to talk about coalition management. We have the background of the prevention science. We know what prevention science is. We know pretty general what this CTC structure is. Now, what do we do with this group of people? How do we keep them? How do we recruit them? You're going to hear a theme throughout this whole thing, and Jeff mentioned it yesterday, but this is not on the mobilizers or the coordinators. Every single thing that I talk about in here with coalition management is the responsibility of everyone in the coalition. I know that gets tough. I know it's hard to ask people for help sometimes with some of these things, but if it was only your responsibility, we wouldn't have a coalition. It would just be your job. So we'll definitely cite a few examples. We really want to encourage you to ask people around you for help. The whole purpose of a coalition is to get other people around you with different ideas and perspectives, as Jeff went over with the sectors yesterday. So this is a part that can get a little bit of tough with it, but there's also really great opportunities. So we try, I will say, every time that we have a training or a meeting within EPIS, we really try to keep these guidelines. So do these look familiar to anyone as you're reading them on the screen? I see a little head nod. When have we seen them? If you want to shout it out, write it in the chat, whatever works. Anybody? I'll give you a hint. Jeff talked about them yesterday and today. Beginning of the meeting, yep, these were our ground rules. So every meeting, yes, Kayla, thank you for that. So these are our ground rules. These are just what we typically do is we talk about rules or guidelines for effective meetings. So when I first heard about this, it reminded me of, a classroom and your expectations of the students while they're in your classroom. And this is no different. As adults, we need guidelines, we need expectations as well. And people really want to know and understand what they're coming into every time that we meet. So, before, a lot of times what happened is when we talk about be prepared, be on time, whether that's you, the coordinator, or again, if that's everyone else, having that expectation that we're on time. A lot of times these coalition meetings happen over lunch, or, I just said this morning, when I have meetings with schools, they're at 7 a.m. and they have to be done promptly at 7:43 because they have to go do some instruction. Making sure that being on time, again, that starting and ending on time is really, really important. Setting time limits. Again, this is all something that we practice. I am looking at an agenda right now that you all don't have that actually times out everything that we're doing both yesterday and today, and doing our best to stay within those guidelines. That PACE conversation could have been all day long. There's a lot to talk about. We want to set up the expectations beforehand that we're just going to be touching on this. We really do want you to ask questions, but we understand that there's not going to be enough time, and we do have a timeline that we would like to stay in between. But again, we do offer that flexibility. If folks are having really good conversations, good discussions, we don't want to squash those either, but it's a really nice and healthy balance. Following the agenda, people want to know what they're coming in for. They may need to focus, they need to reframe their day. I'm gonna, pick on again, school administrators, teachers. They're coming from the classroom, running into your meeting, and they need to know what they're here about. They don't have a lot of time to refocus because they're running all over the place. And I know that's so true for so many of us and what we do within our jobs as well. Follow the ground rules. Again, Jeff and I had up the same ground rules yesterday and today. We typically start with the general ground rules. And then we ask, is there anything on here that you can't live with that we can take off the list, or maybe add a little addendum to, or is there anything else that we'd like to add as a group? and checking in with those ground rules at the beginning of every meeting. I have seen some groups have them laminated, and it's basically like a little poster that they bring with them. I've seen groups just go over ground rules like we have. But again, setting that expectation of your members of, this is how we expect these meetings to run, and we want them to be consistent, and we want them to be worthy of people's time. So we want to have fun. This work is hard. This work is serious. We're doing a lot of serious things. We want to make sure to, and just like I think Jonathan mentioned earlier, this work takes a long time. We don't wait until we have, cured substance misuse disorder and have a celebration. We want to make sure that we have fun, that we're celebrating those small victories, and sharing really what's been positive. It's so important for, not only team morale, but, education and moving forward. Any other guidelines that aren't listed here that folks were kind of interested in talking about a little bit? Anything that you would add, anything that you found super effective for meetings that you try to abide by? All right. If you think of anything, of course, as we're going through, please mention it in the chat. I want to make sure that we are learning from each other. I know many of you have had these coalition meetings and are maybe discovering things that you would like to keep as a guideline.
So I just have one thing to add, and my mother taught it to me. Because many of our coalition people are coming after work or parents or whatever, my mom always said, feed them, they will come. So
we say that a lot too.
Yeah. I mean, first of all, they're coming. Lots of times if they're family members, I have a little area where they might want to have young people over there. Before COVID, we do this, but I always feed people, and they come on time because they want to eat and they want to get the meeting going and go home. So that's just, you can have something provided, but it's thinking about that person that might be coming from work, coming to that meeting to go, and they've had a long day.
And also over lunch, some people do take their lunchtime to go to some of these coalition meetings. If it is not in your budget to be able to feed people, there's a lot of different creative things to do. One of the sectors that we talked about yesterday are like the business sectors, like local businesses, see how they can come and become involved, whether they're donating any food for their meeting. It's going to help them get involved in different ways anyway. So there's definitely some ways to handle that. If we had you all together, we would have some sort of food somehow, some way. So we'll pretend for now.
Food is a great idea. Has anybody here ever been hangry? I have. So sometimes we're in the meeting and we want to have those open conversations, and we're going to talk about this in a few slides, but sharing our values and sometimes managing those conflicts, that can really help. So that's a great idea, Christine.
Yeah.
I see Kayla hopped on. One of the things my old coalition does that Kayla is now the executive director for and still does, we would have our meetings in the back of a pizza shop in the back room so that the members could, we didn't have a budget for it, but the members could order their pizza and either eat there or take it with them.
That's great, Al. Thank you. All right. Again, just a little bit more of the guidelines for effective meetings. We want to make sure that all members have the opportunity to contribute. I've seen this done many different ways, and I welcome your, what your kind of tips and tricks are too, but not all members are going to be comfortable standing up and sharing their opinion or perspective with the group. Thinking about, I'm trying not to steal your thunder too much, Jeff. Jeff's going to talk about communication, but people have different ways that they appreciate contributing, whether that be via communication, food. We're going to talk in a couple of minutes about an involvement period, a pyramid, and we're going to talk about the different ways people can be involved. So, keep an open mind about that. Think about how you can utilize folks' interest and their strengths. Bonding time is provided. It says bonding time and not icebreakers, because I know some people hear that word and they don't like it. I love it. It actually pained me a little bit to take an icebreaker out of today, but I wanted to make sure we had enough time. But bonding time, if you're relating to the people around you, and just like with SDS, of course, if you have that bonding with them, you're going to be more likely to come. If you get an email from the mobilizer when you weren't able to attend and say, hey, just want to make sure you're okay, we missed you at the last meeting, you're going to feel like you're bonded to that group, and that, when you're not there, you're missed, because you have valuable contributions to this group. You're not just there for the food. You're not just sitting there maybe to get out of work or just kind of a warm body. We want everyone to feel like they are contributing majorly to this group and feeling that connection. Again, if you are going to set decision-making guidelines, stick to them. Think of kids again, but mean what you say what you mean, that consistency, so that folks have the same expectations coming into each and every meeting. Action steps. Is there anything that we're asking folks to do from now until the next meeting? Do they have quote unquote homework? Are we going to ask them to bring a friend to the next meeting? Are we going to ask them to review a couple pages in the pays? And if it's not action steps between, talk about what actionable items you're going to be doing as part of the next meeting. So participants, it's not only great organization skill, but participants feel like, they know their purpose in coming to the next meeting, and they're ready. They have those expectations. Refer to mission and vision statements. I think I tell this story all the time. It used to annoy me, but my boss used to, before we started every meeting, he had me recite it was just the mission statement to the Boys and Girls Club that I worked at. I realized, again, it goes back to that focus, goes back to the agenda. Folks might be coming, you don't know what's happening in their lives, you don't know what's happening at work, what they just came from. It works on refocusing the group. And it also works on, I always recommend, when coalitions get together, one of the first things they do is create that mission and vision statement. If they've had it for a while, make sure you review it. Is this still something that's valid for our group? A coalition is a bunch of folks coming together for one purpose. So even though they're bringing their different ideas and perspectives, which is needed, you're all sitting there for one purpose. Just like we looked at the Institute of Medicine, that spectrum, we can't do it all. We have to be able to sit and focus on what we need to do as this group, as this coalition, and do it well. So really, really recommend those things, whether you have it, again, hanging up, if it's on top of your agenda. If you want to make people recite it, I don't know if I love that because I had to do it, but maybe it's not a terrible idea because I remembered it. And it got me focused on the meeting because I was always running. Showing appreciation for board members. Sorry, Jeff, but I'm going to steal your thunder a little bit more. Treat your board members like they're volunteers. Not everyone has to be there because of their job. And if they are there because of their job, they don't really have to participate as part of their job. They can be part of that warm body. Show them appreciation. I mean, they're there doing work for the greater good of the community, for their organization, and hopefully for themselves as well. So appreciation doesn't just mean, trophies, or sometimes people really like the awards to hang up in their office. Get an idea from your folks as to what they would like to be appreciated. It doesn't always have to cost a lot of money. Celebrate often. This is one of my favorites. We're in a really good time of year where it's a nice reminder to stop and take the time to celebrate, not only because of the holidays, but because of the start of the new year too. But don't let that be your only time. Make sure that as a group you're celebrating. It's going to create that bonding time. And again, that's not something that has to really cost a lot of money. So I did just mention this. This is our theory of engagement pyramid. A lot of times going into coalitions, the thought is everyone has to be involved in the community 100% of the time, no matter what. And that's not exactly the case. Now, before I get into this, I'm going to say we don't want everyone in one category. We really want folks spread out and have different levels of engagement for your coalition. So we're going to start at the bottom and talk about awareness. This is a really great resource. It's on communitycatalyst.org, which has a lot of really, really great resources for coalition and coalition building. But you are going to have some folks who are aware of an issue and have the knowledge of the group that are providing strategies for solutions. So they know what the issue is. We know we're having some problems with, healthy youth development. And it's important. It's important that they know. Might not be super important that they're at every meeting or any meeting. Can anyone think, whether it's the CTC process or not, kind of who the folks that we may be talking about, either their position or, I'm thinking specifically about what they are called as part of CTC. Does anyone want to throw in the chat kind of who would be appropriate to be on that level of awareness for your coalition? Everyone, yeah. When I think of awareness, I'm thinking of those key leaders. So I'm thinking about, any maybe like state level governments, county commissioners, local and state government, superintendents. It might be important for them to have that awareness, but they're not necessarily going to have the time to go in and really come to every meeting and participate in every meeting. The next level on here is interest, understands a cause, interested in learning more, and might participate in the group supporting the cause. So they may be some more of those big influencers, folks who may have some, something to contribute, resource, time, money, at least an awareness. And then they may have folks who work for them or be able to appoint more appropriate people to really be on the board and really be those what we're called worker bees. So participation, these are the investments. They are attending the meetings, so they support the cause by providing either their time, their company time, and if they have any financial or social capital. Commitment, those are the folks that can tell you the mission statement in one breath. They are part of work groups. They are supporting the cause. They really understand what that mission and vision statement is. They understand what data that they're using. And they use their specialized skills to be able to enhance the coalition. You might have someone come in who is really, really great at social media. They might be your social media manager, or that's the part, we really let people self-identify what they would like to contribute to the group and really what's needed. Leadership serves as decision makers of the cause and engages others in the work. That's a lot of our mobilizers, our coordinators, our board presidents, the people who know this coalition in and out and are kind of behind the scenes a lot of times, making sure that everything goes smoothly. So really, the purpose of this theory of engagement pyramid is not, you don't have to have everyone 100% in all the time, attending every meeting. There's different levels that you need to get the different needs of the coalitions filled as we move forward. So, Jeff, I'm going to pass it to you. We have a couple more things about coalition management, and then we're going to get into some breakout groups. So Jeff, would you mind?
Absolutely. I think you covered everything already, but we'll go through the slides.
I really did, sorry.
Forward. No, you're good. Everything ties in wonderfully.
I didn't hit my stars. Okay, take it away.
So this slide is how do you build mutual support openness, and trust in your coalition. And those things are all so important to make sure that the group works together towards those common goals. The first step is to emphasize each member or potential partner's strengths. Excuse me. Does everybody remember? I know it was yesterday morning and it seems like forever ago now, but we talked about those work groups that make up the CTC process. And every group, they look a little bit different, but in general, there are about 6 that are used for most successful coalitions. Every member brings different skills to the table. They have different strengths. They may, one person may love bylaws. I'm not a bylaws person. Does anybody here have a member or somebody they work with that loves bylaws and works well with them? I see some nods. I've known a few. I see the purpose in bylaws. I love when bylaws are complete and structured and they help prevent problems down the road. I'm not a bylaws writing person, so I appreciate those strengths in other members that maybe I don't have. I love looking through data, and I know from leading my old coalition, not everybody loved diving into data at the same level. We need to appreciate and recognize those strengths because all of those varying skills make us stronger as a group. Seeing mistakes, differences, and conflicts as opportunities. Has anybody here, let's see, we have 27 people in the room right now. Has anybody here ever been wrong before? I see some hands up in there. I should put both hands up. Never, Misty. I've been married just long enough to know that I'm probably wrong more often than I'm right. But what's great about that is these are opportunities. Sometimes, Brandon, you just turned on your video, so I'm going to use you as an example. Maybe Brandon and I, we're in a coalition together, and we're having a conflict for the right way to go about something. And I can't think of an example off the top of my head, so we're just going to say we're not agreeing on the right way to go about something.
Whatever it is, I'm probably right, but yeah, go ahead.
You probably are. I'm going to go with that. There may be times where Brandon's right or I'm right, but if we all had the exact same view, 1, how boring would it be? And 2, how many opportunities would we miss out on because we don't have those alternating views? We all think about things a little bit differently. We all bring different skills to the table. But even if we dig farther, have you ever had times where you're having a conflict or a disagreement with somebody? Maybe as you ask more questions, you're actually saying the same thing, but your different experiences led you to process it to sound like you were disagreeing. I see some nods. I've had that happen before. So those conflicts, I'll share with you. Conflict is something that makes me personally uncomfortable. Some people thrive in it. But just recognizing that those don't necessarily have to be negatives. As long as you're approaching those situations in the right way, it can actually help you to build the mutual support, openness, and trust. If we're having a disagreement and I go to Brandon and I say, listen, I know we're both here, reference bylaws that Megan mentioned here, reference those things that we agree on that we're going to do for youth in our community. I know we're both here to do X, Y, and Z. I'm seeing it a little bit different. Can you explain to me again what you're trying to say, so I just make sure I understand it? The simple things like that can be so powerful, not only to help Brandon stay engaged, but to help me understand maybe we're saying the same thing, or maybe I'm wrong, and that can happen too. Or maybe we're both right, but there's a little bit more data to support one way than the other. Thanks for being my guinea pig there, Brandon.
I mean, I actually like conflict, but I found, in all seriousness, usually it's a case of we're both right, but we each might have information the other one doesn't. And so the answer does come in between, because I might know something you don't, and you almost assuredly know something I don't. And I was right by my reason or by my facts, but yeah.
So don't get into an argument with Brandon. I've learned that today. But if I do, we're going to see it as a potential opportunity to build our trust together, Brandon. Respecting each other's unique expertise, background, and personality. We have 27 of us in the room right now. Does anybody have the same experiences in the room, or the same expertise, or the same background? Absolutely not. In my undergrad degree was in computer science. Is anybody else here a computer scientist? Christine, were you, or are you just the thumbs upping? I don't usually find many. I spent 13 years of my career leading a government contract doing background investigations. My expertise was a little bit different than a lot of my coalition members whenever I was a mobilizer. Those things make us stronger because we bring new skills to the table, and the more diversity, the more of those, covering all of those skills that we bring to the table, the more likely we are to see success for the communities that we want to serve. Let's see, next we have affirming each other's commitment to community improvement. I just gave an example of Brandon and I are maybe having that disagreement by saying something like, hey, Brandon, I know we're both here to do X, Y, and Z. Let's talk this through a little bit farther. I know we're both here on the same page. Say that, be honest and open about, hey, we're here for the same things. Let's find the way to do this the best way moving forward. Megan, if you'll move us forward, the next slide we have is keeping volunteers motivated, which is sometimes challenging, but can be super rewarding too, to see members of your community stepping up and doing the work in a volunteer basis that helps the community and the youth of the community to be successful. So how do you keep them motivated and engaged in doing the work that needs done? Connectedness through common values and mutual trust. We just talked about some of those ways to build mutual trust and some of the ways to reference back, hey, I know we're here to do the same, we're both here for X, Y, and Z. Let's talk about these things. Making sure to keep those connections open with all of the members that you're able to can help keep them motivated and be more likely to have them keep coming to your meetings and participating. Recognizing the uniqueness of each volunteer and what they bring, as we talked about in the previous slide, everybody brings different skills, everybody brings different values, maybe a little bit different knowledge. Brandon, I know he joins a lot of our learning community calls, and he'll often say, well, I'm not a mobilizer, but Brandon, I will give you credit. You bring skills and you bring expertise in a position that nobody else in the room has, and that adds value to all of our conversations. And the same thing is true in our coalition work. If you remember yesterday, we had that slide that had all those bubbles of all those different sectors to engage. The more of those that we're able to bring to the table, the more of those people that we're able to keep engaged, the more likely we are to see positive outcomes in our communities. And then we see empowerment through engagement. We want to empower our volunteers. Some volunteers, sometimes we're hesitant. Megan made the reference that I used yesterday. It's communities that care, not the mobilizer that cares, which is hard sometimes because you're oftentimes the only paid staff. But you have some volunteers in your groups that are probably there because they want to take on extra responsibilities. Some are there, as Megan mentioned, because of their work position. So it's important to really know your volunteers, know what their capacity is, and know what their issues are. And how are you going to know what that is? Does anybody have a superpower where they can say, okay, Lasar, you just popped up on the top of my screen. Here's what Kayla's capacity is as a volunteer in my group.
I do all kinds of inventories.
It's like asking them those questions on a survey.
I do medicine wheel and geese model. Every time I get them ice cream, how they do the ice cream, all of those, so that they can learn about themselves. But also I can learn and say, okay, if you're a buffalo, I know I want you to be in leadership because you're going to go, but you need to have a team of mice with you because sometimes you just take off and forget about the folks in the back. And it helps the dialogue. So I use that kind of stuff and the geese model of leadership. So
I like all the animal analogies. We might have to dive into that some more together
the
sometime.
geese model, look it up. It's actually the way the geese, if we need it for our coalition. So the way they fly, they can fly from north to south.
Yeah.
If whoever's in the front, when they get tired, they drop back and the next one moves up and the next one moves up. So with your coalition, if you get them to understand, I'm not always going to be at the front. You got to know everything I know. You got to keep moving, because in order for it to happen and for us to get to our destination, everybody got to do it.
There's times when I'm going to be in front and I'm going to get tired and somebody else needs to step up and fly.
Exactly.
Christine, I have a question for you.
Yes.
Did you ever look up and see a flock of geese flying through the sky?
Yes.
Did you ever notice how there's more geese on one side than the other?
There's always one more.
Oh, I said it wrong. How one's longer than the other, and the answer is because there's more geese on it. I was trying to tell a dad joke and I failed.
Oh, okay. Okay, but I'm still smiling. So at the end, you still got your outcome because we're smiling. So that's good.
I messed it up. I had my one chance there and I tried to take it. But yes, thank you for sharing that.
No, it's not your one chance. You'll be back. I know.
All right. I'm going to try harder next time. Megan, if you'll move me to my last slide before we dive into some breakout activities. So have any of you ever had volunteers leave your group? These are some reasons why volunteers, quote unquote, jump ship. Maybe these apply to you. Have you ever been a part of a group before and maybe you stop attending? Here's some reasons why. The members or the volunteers, they can feel a lack of connectedness to the group. They can feel that their assignments are ambiguous. And that's a challenge because, as we just talked about with Christine, it's important to know the capacity of those volunteers. Maybe somebody really wants to be involved. They want to be the one, if you're doing something like a backpack program for food to help kids, they want to be the one that are there with their hands on packing backpacks. But if you don't ask, if you don't know those things, maybe you think, well, I don't want to bother them with this. And they may feel like, hey, I'm not being involved, so I'm not going to keep going. But maybe they want to have their hands on. A lack of organizational support. We talked earlier about things like having those bylaws in place that we can reference back to and point to those supports whenever we meet those maybe decision points with the group. Feeling out of control. And there's lots of different examples for this one, but one comes to mind is, have you ever had somebody in a meeting, or maybe it's the same person, maybe it's a different person every meeting, where you want to talk about a topic and the conversation goes sideways and it's not productive because you're not meeting those goals? Sometimes the other volunteers or members can feel like, hey, we're not staying on topic here. That's not the purpose of this group. So feeling that the meeting's out of control or not being, following the rules and those ground rules that we've talked about. Maybe their expectations aren't met. Maybe they're there because they want to see violence reduced in their communities, but you're talking about mental health. Well, that's why it's important to have those bylaws established. And with the process like CTC, we look into our data to figure out together with the data committee, what are the things that our community needs the most, and what are the things that we can realistically address, so we can set those expectations so that they're not, not met for somebody. And the last is feeling that they're not being heard or guided. Phyllis, if she were here today, and I hope that she's doing well, she would always say in this section, everybody who comes to a meeting needs to bring something to the table and they need to take something away. So if we were all in person right now, if you could picture, if we were all sitting around a coalition table, would anybody like to be there if you feel that you're not being heard or listened to? No, would you stay very long if you weren't? Unless your job required it, maybe you would, but you're probably not going to be engaged. You're probably less likely to stay. So these are some high level ideas to think about, because maybe you have a member in your coalition right now that you have in mind, or multiple members who they're not as engaged as you'd like. Maybe their needs aren't being met in one or more of these areas, and they may be considering jumping ship. And this is meant to help you try to address those things so you can keep all those volunteers that are so crucial to our work in community coalitions engaged and working with the group. Does anybody have any questions about, I know we covered pays earlier, or any of the other topics that we covered today, before I toss things back to Megan? All right, Megan, the show is yours.
Thanks, Jeff, and thanks everyone for your suggestions, participation. Now is the time where we're going to put you into some groups. I have attempted, behind the scenes, to strategically put you in groups where you are not with someone that you would typically work with. I know there's a couple of people from the same coalition tried to split you up, may not have been perfect, but every room is going to have about 5 people in it. Every one of your rooms is going to have one representative from the epicenter in there. That person is really just to, sorry, let me move this over. Really just to make sure that the conversation's moving well, might be able to give you some resources if some people are asking. And that is who I made your team names. So some of you will be in Team Jeff with Jeff Hogan. Some of you will be in Team Heather, Team Nicole, Team Roger, and Team Jordan. So what we'd like you to do is to take the next, I'm going to split the time that I wanted. I'm going to say the next about 17-ish minutes. You're going to take the opportunity, and just like I did yesterday, I will broadcast these out and really want to get you talking and connecting with one another. Just like I mentioned earlier, talking about exciting opportunities that you have coming up, either now currently or within the new year. And also take the time to talk about some obstacles that you might be facing. So we really want to make sure that everyone has an opportunity to speak. Again, I'm sure we're going to wish we have more time, but hopefully you have a good chunk of time to talk about some of these things. When we come back, we're going to have about 10 minutes to do a report out. So before we leave, I'm going to ask everyone to pick a representative from your group who's going to just share a little bit about what you all talked about. That representative is not going to be someone who's from EPIS. Going to mix it up just a little bit. So make sure you pick your representative who's going to speak out for the group. And we're going to give you, I'm going to say 60 to 90 seconds to give us a quick wrap up of some notable things that happened during your group conversations. Are there questions about what we're doing? All right. I'm going to send you away. If for some reason, I didn't mention this yesterday, if for some reason you get kicked off the Zoom, jump back on, you'll come back to the main room, which I'll be in, and I'll put you back in your group. I forgot to say that, but I don't think anyone really got booted last time. So, all right, away we go. If you want to change your team name, that is between you and your team. See ya. Pass it over.
So we had a pretty great group. We found that there was 4 different coalitions involved, and 2 of us have been pretty established, and 2 have been recently just formed. So we had some great conversations on, what's working, what's not, what are our biggest obstacles. And I think the biggest thing, the biggest obstacle was keeping our board members engaged. Opportunity is, yes, we have them coming to the table, but keeping them engaged. And there was a couple of us in our group that said, we have a hard time saying no. So we're not those ask people. And I have to admit, I'm one of them. Maybe I just take on more and more because I feel bad asking, because I know, and in particular, our small community, not only do they sit on our board, but they might sit on 3 or 4 other boards, and they're heavily involved in the community in other ways. So we found that, that ask sometimes is hard, and, but if we can kind of overcome that, in one of the newly formed, Lynn, from Healthy Community Partnerships, I believe, I think I got that right, Lynn. I apologize if I didn't. She had mentioned that she had worked for a nonprofit group before, and the key was for her was to, maybe it took 4 or 5 asks to get to that right person, but you used it as, Megan, I would go to you and I would ask you, and if you gave me a hard no, I would say, well, who do you know that might be beneficial to our group and that might, be a great asset to our group, and so on. And again, not getting discouraged whenever people do give you a no, because, maybe they're just not right for the group and for what you stand for. So I think we had a lot of good discussion on that. Finding those sectors to make up those, all of the sectors. I think that all of us had mentioned that, I don't think, and I correct me if I'm wrong, none of us have all of those. So building upon those, getting those key players into there to fill those sectors. Roger had a great thought too. He had mentioned, for getting those board members involved, we're coming, with COVID, a lot of our board meetings have went virtual, keeping those board members engaged, kind of bringing them together, maybe doing some sort of event, and doing like a community board orientation, kind of to pull everybody together again, just to bring that vision back to what we're trying to do, and really sticking and getting back to that strategic plan of carrying out our mission and dividing those tasks up, accordingly to your group. that's pretty much all I had. Sorry if I went over my minute or minute and a
No,
half.
that's all right. That was great. And that's why you'll always hear us say, you know, it's not the mobilizer, who cares? And we, you know, we say it like it sounds so easy, but we know that that's that's a difficult task, that, you know, it's hard to ask people for things. So, you know, we'll keep reminding, hopefully we'll keep getting tips from other people and keep being empowered to, you know, ask members of our coalition and community to help. So thank you.
Thanks.
May I have a volunteer to go next?
I'll go next.
Was that Erica? Oh, no,
That
Nicole.
was me.
Oh, go ahead, Nicole.
I'll go next because we echo a lot of what Kayla was saying just about, you know, the Zoom meetings just not being ideal for folks who may live in the rural regions or the elderly population who aren't that well versed in using technology. We also talked about how, you know, all the virtual meetings have kind of caused almost like a disconnect or a loss of the safe space that used to exist, where so many people felt not only physically safe in the environment, but it almost became like a tradition, something you look forward to. You know, you come in and you know what to expect and you'd be happy to see the folks there. And it just kind of empowered the group to, you know, work harder, or stay motivated and stay engaged. We talked about that. We also talked about the challenges of during COVID of parent engagement, how quickly activities became just kind of like a drop off or a pickup, rather than come in and talk to the facilitators or you know, the coalition coordinators and that sort of thing. So it was a little bit harder to engage with parents because you weren't seeing them all the time. We also talked about the pros and cons of what COVID has kind of created for us all. Super positive that we're getting a lot of federal and state dollars flowing into the counties for really important work to be done. But the con to that is that there's just not enough staff willing to work to meet the needs for the programming. And that's both we're noticing it academically and then through the providers. So that was a challenge. And then overall, just violence has increased, and there's just not enough aides, support staff, police resource officers to kind of support intervention with that. Did I miss anything, group?
No, sounds about it, about everything.
You captured it well, Nicole.
Thanks, Melissa.
All right, thanks, Team Nicole. Who would like to go next?
I'll go next. Our group, fairly new to CTC, but some opportunities were collaborating with other organizations, an upcoming meeting, networking. This whole training is a networking opportunity. So that was a wonderful opportunity highlighted. Understanding that this is a learning process, new to CTC, an opportunity to work with workforce initiatives, and just being accommodating in terms of meeting times, meeting space. Some of the obstacles were some hiring issues, and someone highlighted hiring coalition coordinator being an issue, to bring people into the fold, learning in this in virtual environment, and getting the coalition members to understand what CTC can be, and highlighting what makes the work that we're doing with CTC different from all of the other meetings that people are attending, bringing people back together, and some concerns around that. Some questions also were highlighted, like, you know, in terms of ideally what the size of the CTC group should be and how often they should meet. Did I miss anything, group?
Thanks, Erica. My only question to you is, what group are you representing?
I think I forgot the name of the group.
Heather, Jeff, or Jordan?
It's Heather.
Heather.
Okay, awesome.
That's Heather.
Bye, Kayla. Thank you. All right,
Okay.
Team Jeff or Jordan? Oops, sorry, I just heard someone jump
No.
in before I even. Go ahead.
Team Jordan. Where we go? Huh? Where we?
Oh,
Yeah, I'm here. Can you, is it
hi,
okay?
Christine. I wasn't sure if that was you or Trina talking. It's so hard.
Oh,
Okay, go
I'm
ahead.
doing like three things. I mean, I'm gonna be
Okay.
honest. I know that this is a powerful meeting because yesterday everything blew in my house at one time. So I have an electrician trying to figure out, and I'm with extension cords because this is important. So
Oh, gosh.
yes.
Okay. Yeah.
No, we're fine.
Are you the spokesperson too while you're doing all this?
Yeah.
Oh,
I'm
all right.
coalition. That's what you
Go
have
for
to
it.
do. That's why I do the geese model. We got to fly. We got to keep it going. We got to keep the work going no matter what. So yes, I'm doing that. I'm taking care of my mom with Alzheimer's. I'm eating lunch and I'm talking to you and it's fine. And we're going to go. That's what we have to do.
You are absolutely correct. We
Yes.
balance everything as mobilizers. So
Yes,
go for
yes.
it, team.
Yes.
Sort
So first of all, we actually had an excellent meeting because we already just like decided to come together and do more work after this, collaborating, working together. The opportunities that just this training has, the workshops and all of that, giving us ideas and letting us know we're not all crazy, but we definitely need to follow a lot of the resource supports that were there and that were offered. Doors opening as it related to, for me, I'm going to be on the bandwagon. Additional information and data and all that will help us to work with our coalition members, and everyone was talking in reference to that. How to bring, we had a member that was talking about what was needed. And so we didn't just hear what was needed, but then we problem solved how we could support each other. So one was support with a Hispanic Latino coalition support. And we said, okay, well, there's one in Philadelphia that is a community like that. We might be able to work that. Another person was talking about the need for more data supporting and resource and the police and coming together. Well, Michelle Hayward has a regular meeting. So we just really kind of problem solve about, well, this is here, this is there. All right, let's collaborate together. Let's kind of work together after this. So I think the outcomes, when we look at the outcomes and bringing us together, the healing that needs to happen to make a difference with the community was the work. And we decided the best way to do it is to model. So our team's going to get together and help each other with what they saw they needed next steps before y'all even tell us to do it. So collaboration, and then we, like I said, model the collaboration that we see needs to happen just with our one room, but then possibly growing all of us, because I'm very invigorated that all these people are here. And you feel a little crazy sometimes, but when you're on this Zoom with a lot of people that probably will feel a little crazy sometimes, and why doesn't everybody get this or what or whatever, I'm excited about the fact that we're all together and we can do something, if small, make a difference. So I did good. Okay. I make sure I'm looking.
Thank you for that. And we say we do these, we have learning community calls, we have these trainings, because a lot of times you can't walk down your hallway at work and go talk to another mobilizer. I mean, This is a really specific job. We're doing really specific tasks. So we want to make sure that you do all keep that connection. And your team gets double gold stars and ribbons, and that's very cool. So I'm really, really excited to hear, and I'm excited to hear what comes of that, of, you all staying connected.
Not a problem.
Last but not least, Team Jeff Hogan.
It's actually Team Jeff's karaoke, from what I understand. Yes.
Can I veto, or do I get no say?
No,
all right, Team Jeff's karaoke. Are you going to sing? Are you going to sing your summary?
No, we vetoed that.
All right, take it away, Trina.
So we started out with a couple of the opportunities that we're looking forward to in our groups. One of our we're all very new. We're all new to the PCCD grant in the group that we were in. And so everyone's just getting started with things. But one of our groups already has their first meeting set for January 11th. And they've been doing a lot of work on the contact list and the invitation and things like that. So there's a lot of forward movement with that group. And another group is meeting with the local Chamber of Commerce next week, and has been making connections in the community. And the group, before this person came on board, the group was also, had a few meetings already. So there's a good movement there. there's a little concern about the current conditions and the whole Zoom meeting and kicking things off with Zoom meetings and trying to keep people engaged that way. And I'm kind of in that same boat as well. We're not sure yet how we're starting our first meetings. And then another issue is being a new community coordinator and just learning all of the constituents in the area and trying to figure out who to invite to the table. As you know, brand new in a new area, working in a new area, that's also a concern. So we had a few really positive things and then a few things that have to be worked on. Anything else, group, that I missed? Besides Jeff singing?
Yeah, I mean, that's not something that's missed, but something that didn't happen per se. So forgot, in celebration, usually I make sure I celebrate everyone after you present, after you talk. So please give yourselves a celebration, whether it's a pat on the back, a clap, a reaction. I love these reactions. I use them often. So give yourself some props, give everybody else some props. I really appreciate your sharing. Here, I'll give a little Santa because he just looks cute. So congrats to everybody. Thank you all so much for sharing. I did have the opportunity to pop into 2 rooms. It was difficult because my audio was a little bit lacking. So it did sound like great conversations were happening. We are getting ready to wrap up. So there's just a couple loose ends I want to make sure that we get. I want to make sure we hit our expectations. If we have not hit our expectations, I'll certainly write them down so they can possibly be a future learning community call. I heard a lot of reoccurring themes while you all were talking about what you discussed during your groups, which again is giving me ideas for more themes about learning community. One of the big ones I wrote down was engagement during virtual meetings. So I'm wondering if maybe, sometime that we come together, we can explore that topic a little bit more on how folks get people engaged virtually. Because I think for so long we kept hoping and waiting that we wouldn't have to worry about it much longer. But I know some groups are more comfortable that way, and it seems to be more of the norm. So we'll see, but appreciate it very much. So I'm going to share our expectations that we had yesterday. I did get a chance to read over them a little bit. And I want to get, speaking of those reactions, I want to get a thumbs up or a thumbs down. And Jeff, I'll probably have to have you and others look and see how we're doing. Either a physical thumbs up or thumbs down, or a thumbs up or thumbs down from your reactions. But I want to see how we did on some of this. So I'm going to check some things off. Let's see here. Okay. So the first one that we're going to explore is getting a refresher in. So we got get a refresher in the CTC. I'm going to say process. Was that accomplished for people who maybe have had this before or have been in CTC a little longer? Give me a physical thumbs up, thumbs down, or a reaction, thumbs up, thumbs down. All right, I'm checking them off. Check. This goes a little bit along the same line, but overall learning about CTC, and we'll just do that one by itself. So overall learning about CTC, thumbs up, thumbs down, thumbs up. How do we become a CTC? That's a good question. I see some thumbs up. That's maybe something that we can explore a little bit further, kind of more of those beginning steps. So I'm going to keep that on there. Learn more about the CTC model. That was pretty similar. Thumbs up, thumbs down. Thumbs up. Understanding what CTC is and how it can make a difference in our community. That's kind of 2 in 1. I think that we can further explore a little bit more how it can make that difference and really some of those greater outcomes. We didn't do anything as far as the research on CTC, and that's certainly something we can do. So I'm gonna leave that sort of. Deeper understanding of CTC best practices and standards. I do care about my community. I don't know if that's an expectation, but I like it. So we're gonna give it a double check. That's okay. Check, check. Understanding on how to build, I don't know if that would have been like strength or strategic planning. Does anyone have any idea? All right. Let's give ourselves props. Okay. Find a way to strengthen our coalition. That's a really, really good one. How do we feel about that one? You can do an okay for in the middle too. I didn't give that an option. Sorry. I'm just seeing stares. Anybody? Okay, I see one thumbs up. Okay, so kind of. I can definitely leave that. Getting to know some other prevention people in PA. Let me say I certainly hope so. How to implement the CTC model. See a thumbs up. I see a kind of, so we can leave that. Yeah. And this training is not intended for you to go out and say, you know, have fun, go do CTC, and we'll talk to you. Never. Again, it's just a taste, just that little blip into CTC. So I'm going to stop sharing. Eric, I see that you have your hand raised. Sure, go ahead.
Hit that button.
Oh, a mistake. Okay. Maybe you're just waving at me. All right. In the interest in time, I am going to ask if you do have any questions, any follow-up, please email me, email us. Jeff, if you could drop our email addresses again in the chat, you're going to be receiving the PowerPoint, the recording, the like the resource list. You will be receiving all of those. I am going to say tomorrow morning, if I can get it done today, I will. And then you will also receive an evaluation. And again, look in your junk box for that. You might get it there by accident, but please fill out the evaluation. It's how we plan for these trainings. We really appreciate you being on here. You know, let us know what you think. Let us know what you're interested in learning more about, and we're always here to help. So thank you all, and have a happy holiday. Hopefully most of you get a little bit of a break and take some time to relax and be with your families. So see ya, thanks.